So I am back. I am ready to film another video. I wanted to stay on top of filming about one video every week. I have a bunch of topics that I want to do. However, life happens and I ended up having to move home. So this is my room at home. It's kind of childish. I'm in the midst of trying to like repaint and reorganize furniture and stuff like that, but it is a lot of work obviously. And all four of my family is here. Both my parents are working from home. My brother's in school. I'm also in online school. So it's been a lot. It's been kind of hectic, so I haven't really gotten a chance to get to that yet. But I want to. So basically, this video is going to be about working on a COVID-19 unit. I do not work on a COVID-19 unit. I am home. But my friend who I went to high school with, when she saw that I made a YouTube, she said that we can make a video together. And I remember that she works on a COVID-19 unit. So I figured it would be a really cool and like informational video to kind of see what it's like in the front lines from a perspective of someone who is a certified nursing assistant. Now, I don't think she went to CNA school because we are both in nursing school. We're in different programs, but we're both in nursing school, and most places will let you work as a CNA or a patient care tech if you have 1 year of clinical, which she does because her school is a 4 year program, and she actually started her clinicals, I believe, her sophomore spring, whereas I started my junior fall. So yeah, stay tuned for the call to just hear about everything that that she's going to talk about and bring awareness. I do have some questions for her because I'm not really sure how exactly she wants to go about talking. But yeah, I'm excited. I feel like it's important for people to see what it's like, what's going on in the front lines. I feel like that really motivates people to stay in quarantine because every time you go out of your house, you do risk putting someone else, potentially if you're infected, at risk and in the hospital, which in the end just makes the healthcare workers more at risk, and it's pretty scary. Like I can't imagine. I'm super like grateful that like I am able to like talk to her about this because it is important to know. So yeah, here's the phone call. Okay. So this is my friend. This is
Hello.
Nicolette. Okay, go ahead. Do you want me to ask you the first question, or do you want to give a little spiel?
No, you can ask me and then I'll kind of get into it from that.
Okay. Wait, I don't have the list. I sent you the list.
So do you want me to just like answer them as I go?
Sure.
That's a lot of conversation though.
Okay, hold on. Let me pull up the messages. Okay, so the first question is, how long have you been working as a CNA?
So I've been working for a little over a year. I started working last January. I started the hiring process in December. And then from there, once I got hired, I did a training process in January. And then within a month or so, I was on my own on the floor.
How long had you done clinical beforehand?
I started, that was my sophomore year going into junior year. So I just started clinicals that same time. So that semester, January, I started my clinicals and I started working at the same time.
Okay, nice. So, how did you feel when you found out your unit was converted to a COVID unit, and what was the unit before it was converted?
So before it was converted, we were a half med surg, half pediatrics unit. So we were
Oh, I didn't know that.
yeah, we were very low acuity because of that. Like we can't have any critical patients on our floor because of the fact that we have pediatrics. We're also not high acuity for pediatrics either. We don't get anybody like that's critical. It's
Yeah.
mostly like just if they're sick with the flu or stuff like that, they come in and we treat them. We have one whole section for that. And we're also a seizure focused unit. So kids and adults with seizures. Mm-hmm. And then when I found out the unit was a coronavirus unit, we were one of the first units. I think we were the first unit actually to convert. I did not know. That was after spring break. I was unaware because I was in Florida with my family. So I had no idea until the day I was coming back that my brother's girlfriend is a nurse at the hospital.
Mm-hmm.
And she texted me and was like, make sure you bring a change of clothes and everything because you are a coronavirus unit.
Oh,
But I was definitely scared because I didn't know what they were going to do
yeah.
to protect us. I had no idea the protocol, nothing. I was looking at emails. They said they were giving us a mask when we came in and getting temperature checks when we come in.
Mm-hmm.
But other than that, I was kind of going in cold. I had no idea. But it wasn't too bad when we first started. We didn't have a lot of patients.
Mm-hmm.
We had a few. But then obviously now it's it's been crazy. But I was definitely scared when I first found out.
I can imagine. I would be freaking out.
Yeah. My mom was scared
Um,
too.
okay, yeah, so like do you have like a decontamination process?
Me personally, I'm very, very cautious about what I do. Like, so whenever we go into our like kind of break area, we have a room. Every floor has their own like break room.
Mm-hmm.
So whenever I go in there, like I bring a bag, I disinfect all my stuff. I bring wipes and gloves. I take off my mask with my gloves because it's still, we wear one mask the whole shift.
Mm-hmm.
And I also, people have donated like knitted masks, like
Mm-hmm.
to put over it that they made for us. So
Yeah.
I wear my N95 and then I wear that over it just for extra protection. But I use gloves to take it off. I clean everything. I clean my phone. We have a phone cleaning thing on the unit. So I put my
Mm-hmm.
phone in that. We all put our phone in like plastic Ziploc so we're not touching it. So in that sense, yeah, I'm very clean. I wash my hands. I mean, we should be washing our hands every time we leave a room, but I wash them every single time. Even when I come out of a room, if I don't, I go somewhere else to wash them. I'm on
Mm-hmm.
top of that. And then when I'm leaving work, they give us disposable scrubs. So I come in
Oh,
with
okay.
scrubs and then I change. And then when I'm leaving, I bring a change of clothes and I bring like extra shoes. So
Mm-hmm.
I change my shoes, I change my clothes, I change everything.
That's
And then my car, I have extra gloves and Lysol. I Lysol my bag. I change my shoes again in my car because I'm walking through the hospital with them.
mm-hmm.
And I take off my mask with my gloves because we can't take it off until we leave. So they give us a plastic, like a paper bag, and I take my gloves, I take it off, I put it in there. And when I get home, it's right, I literally change at my door and I go right into my shower and everything goes in the wash. So I do that literally
Yeah.
every single time I work. But I mean, it's just to prevent the spread. I'm not trying to
Yeah,
give it to my family. I
of
still live,
course.
I'm in a two-family apartment. My aunt and my cousins are downstairs from me. I
Mm-hmm.
don't want to get them sick. My aunt is like crazy about that. And my mom and my brother, I don't want to get them sick either. So
Yeah.
it's all about trying to just keep myself clean and feel like I'm clean. So that's what I
That's
do.
really good though. I feel like
Yeah.
I've seen a lot of like, cause I follow like a lot of like influencers. Like I feel like I've seen a lot of people like showing everyone their decontamination process, and it's intense.
It is intense. And some people might think it's kind of dramatic,
Mm-hmm.
but I mean, you have to, like, people have to remember, I'm literally only strictly with coronavirus patients.
Yeah.
So every single patient that I have they are positive for corona or getting tested for corona.
Mm-hmm.
So I'm doing everything to keep myself safe and keep everybody else around me safe. That's the
As
main
you
goal.
should.
Yeah. So it's a lot, but you get used to it after a while. I've been doing it for a while, the past couple of weeks, so it hasn't been bad.
So you said they give you a mask. Do you get gowns as well, shoe covers, or just the scrubs?
So they changed it. They made like a specific room to don and doff your gowns. So
Mm-hmm.
we have a gown, we have gloves, we have everything.
Good.
Sometimes we do
Good.
run short,
Mm-hmm.
and then we have to take certain measures to protect ourselves. But other than that, we're pretty protected. People have been donating so much to us, which is great.
Yeah.
Um,
I remember
so
you did the bingo thing.
yeah, we did that. We donated to 3 hospitals.
That's
Um,
awesome.
which is good. We donated, I think, over 200 to each. But a lot of people have been donating stuff, so it really has been helping us. So I feel pretty good about when I go to work. Sometimes, again, like I said, sometimes we start to run low as it gets later into the night,
Mm-hmm.
and then we take certain measures to deal with that. But I feel like we're pretty good with what we have so far. Thank God. So
Yeah. Yeah,
so
that's
we
really
have
good.
everything: shoe covers, hairnets, gowns, goggles, or like the visor kind of thing,
Yeah.
masks. We're wearing that the entire shift. We don't,
You have 8-hour shifts, right? Or is it
Mhm.
longer?
For us, it's 8 hours. Some hospitals, they do like the CNAs and the techs 12 hours. Some is like optional, but
Mm-hmm.
my hospital, we're strictly 8 hours.
Okay.
Mhm.
Do you feel like it's been like different, like for the patients, like interacting with them? Like, do you feel like they need more or less?
Yeah. That's the one thing that kind of like breaks my heart in a way.
Mm-hmm.
It's hard to see people going through this and not having their families there.
Yeah.
Um, and it's also hard because, we try to be in the rooms and talk to them and, kind of connect with them so that way they don't feel so alone. But it's
Yeah.
also hard trying to manage your times in the rooms.
Yeah.
Because we have
Fostering care and
so,
all that.
yeah, our whole floor is basically filled a lot of the times.
Mm-hmm.
So it's hard when you have a lot of patients. I try to do my best. I try to stay in there, as as much, but as limited as I can, just to keep myself safe. But I do try to stay in there. I talk to them while I'm in the rooms,
Yeah.
um, and try to make them feel comfortable. It's hard when you see somebody so upset and scared, and
Mm.
you feel like you can't do anything about it. Like even talking to them, if it's me, I want my family. I,
Yeah.
I want my family. I want my mom. I want my brother. I want everybody, because it's different. You have a higher level of comfort from somebody that you know than somebody you don't really know. So we try our best. We go in the rooms. They've been playing music when people leave. They're the hospital itself is trying to make it more upbeat, and so are we.
Mhm.
We do our best. The one thing I could say is just going in the rooms and talking to them. Tell them to tell you about their day, anything. We let them talk to us about everything. We let them FaceTime their families.
That's
Um,
awesome.
you know, Even if they don't have a phone, we'll give them our phones. Like I said, we have it in the plastic. We clean it, but we do what we can. It's as much
That's
as we
really
can do.
good.
And it's what we should be doing. That's kind of our job right now, is to be everything to these patients. So
Mhm.
it's hard, but I feel that's like what's the most rewarding part of it, is that you're able to kind of give somebody comfort in a different way this time. So I do enjoy that part of it.
That's good. Do you feel like if you had the option to not work on a COVID unit, like you would have preferred that, or do you think you're okay with the experience and like how everything's been?
I think in the beginning, I would have rather not, because it's scary. We don't know much about it. It's still up in the air. But I think now that I'm there,
Mhm.
I'm okay with it. I think us being in school as students, this is
Mhm.
something we have to learn. This could happen at any time. And
Yeah,
I
I
think
agree.
it's better that I have the experience now
Mhm.
and knowing how to deal with it and, handle myself in these situations and everything, than kind of being thrown into it. Like, we have so many new nurses that started like right before this started, and now this is all they know. And I
Yeah.
feel like it's kind of a lot if you didn't have any prior experience working in a hospital. Clinicals are so different. Like, people don't get that. Clinicals are so different from,
Mhm.
actually working and doing this by yourself.
Yeah.
I think for me, I'm happy I have this opportunity and this experience, and I'm seeing how my hospital really handles it and treats us. And they've been doing so great and making me feel really good to be part of this hospital.
Mhm.
So in a way, I'm happy that I'm a part of this and being able to treat people and get this experience, because I don't think at any other time we're going to be able to get this unless this happens sometime down the road again.
Yeah.
So
Yeah, I think that's really important too, like seeing how the hospital is treating you. Like I've seen a lot of people like discussing how they're like when they're going to interview for a job like as a healthcare professional, like asking like what were the measures that you guys were affording to your employees during
mhm.
the pandemic and everything. Cuz a lot
That's
of people are dying. A lot of
That's
healthcare.
something people need to consider too, especially like student nurses, especially seniors. You need to ask when you're getting a hire, what measures have you taken? How have you been treating your employee? Those are big questions to ask, because
Yeah.
if it's a hospital that's not taking the proper measures to protect their employees, I wouldn't want to work there.
Yeah, exactly. At the end of the day, you're putting yourself at risk.
Exactly. And like I said to you before, I'm per diem. So if I didn't feel comfortable or safe, I wouldn't be working as much as I'm working and
Yeah.
putting
And
myself on the line.
I imagine like all the per diem people are probably working so much too, just because like other
Yeah.
people getting sick, like people not wanting to work anymore, things like
And
that.
we have some immunocompromised nurses that can't work now. They're out.
Yeah.
We have some people that are pregnant that have to go to we have one clean unit I think one clean unit, and then one floor for like
Mhm.
labor and delivery and the babies. That's all a clean
Mhm.
floor.
Yeah.
But from what I know, I think our whole hospital and every hospital is basically all corona so far.
Mhm. Yeah.
Uh, so we have units for those people to work on, like especially the pregnant women, immunocompromised, things like that. So it
Mhm.
has been hard because we have lost a lot of people
Yeah.
from being immunocompromised, that we have to go other places to get other people. But they've been doing a really good job at keeping our staffing high. So
That's
hopefully,
really awesome. Do you
Mhm.
feel like the staff members are like tired and like burnt out?
um, yes and no, if that makes sense. um, I think full time, like I said, you have to understand I'm per diem. People are part time, so we're not working as much as the full time people are. I think in units like the ICU and critical care, I do think they might be
Mhm.
getting a little more overworked than most units, just because those patients are, going through a lot, and they have to deal with all of them, and it's a lot. I feel for them. On my floor, I don't think people are getting like overtired, because again, they've been doing this for so long now, it's just on a different scale.
Yeah.
Like I said, we're doing so much like the hospital and us, we're doing so many things to keep ourselves upbeat. Like everybody's making TikToks to try to keep themselves happy when we have free time. You know, we're doing things to make ourselves happy. And in this moment, I feel like that's important. We shouldn't be taking that away from the nurses. Like they play the music when somebody gets discharged. They've been putting decorations from kids and families all over our units in the hospitals. We have the like a wall now for patients that are being discharged that they can put like a picture up there for them that they left.
Oh,
so
that's so cute.
I think in a way the hospital is really working hard to keep us upbeat.
Mm-hmm.
And I think all of us working together, we're doing it for each other. We're there for each other. So from what I've seen so far, no, I think everything's been kind of upbeat, kind of doing good, but I can see how a lot of people might be getting burned out from this, especially having to pick up extra shifts, having to change shifts, things like that. So
or
I
even
can,
like changing specialties.
yeah, that's another thing. We do have a lot of people coming from like the OR, other places, you know, coming from an like off campus place, like a doctor's office, is going to be so different
Yeah.
to working in a hospital. So those types of people, yes, again, I could see them maybe getting burned out more quick. But like I said, the hospital's doing so much to keep us kind of upbeat and in our spirits. And, you know, they're coming around trying to see how we're doing, and they're giving us different things. Like we have holistic nurses that come around, you know, they give us like treats, they give us
that's cute.
essential oils and stuff like that. So they're doing their best. And I think mostly, like I said, other than critical care, I think they might be the ones that are getting like kind of burned out a little bit because it is a lot. But you know, the hospital's doing their best to keep everybody kind of uplifted and trying to take as much weight as they can off of everybody. So
yeah. All right, so I have one last question. So what's one thing you want people to know based off of your experience?
stop going out. You know, it's sad to see, like, again, it's so hard doing this because we've never experienced anything like this. We've never been put in a lockdown. I mean, from us, you know, our age, we've never been in a lockdown.
Yeah.
But I think what kind of gets me upset the most is I'm dealing with these patients, and so many people are on the front lines risking their lives every day, and there's still people who are just like, I don't care. I'm gonna go out. And I think what people they don't want to put out the numbers of people that are getting discharged, really, because I think they don't want people to think, oh, okay, now I can go out because people are doing better and it's getting better. So I think it's kind of like a balance of trying to find a way to put the good news out, but also still trying to keep everybody in social distancing mode.
Yeah.
So that's the one thing I want to get out. People are getting better, but that doesn't mean go and just do whatever you want again. Go out and don't social distance, don't practice safe measures. I think they'll be doing that. That's kind of the thing I'm seeing a lot is people are like not really caring and going out. Like I know people I have on social media are still going out, still, you know.
I know. I judge them so hard.
And again, I know it's hard, but think about the people that are on the front lines. Not just me. Think about the nurses, the doctors, firefighters, cops, grocery store workers. These are all people that are still like dealing with patients and people going to these places. So I think that's the one thing I want to get out. People are getting better. We're getting closer and closer to figuring this out, but we're still not there yet.
Yeah.
Well, so that's the main thing I want to get out. Practice social distancing, be safe. We're all going through this together. It's not just you, it's not just me, it's everybody. So, you know, do things, like I've picked up so many things during this time. You know, I started doing yoga, I've been working out more. Pick up things, FaceTime your friends every night and party on FaceTime. You can do that. You can have a Zoom meeting and you could, you know, drink and party with your friends. Exactly. Like you don't have to be going out every night and partying just because you're not in school and just because, you know, you can.
Yeah.
I think that's the thing that I want to push out there is try the more we say in social distance and, you know, practice this, the less people that are going to get it and the more or less time we're going to have in quarantine, you know?
Yeah. The more quickly that like it's flattened and like people are actually able to figure out what it is that we can do. Like I know like they were saying like they want to try to like get everyone tested, and then from that point you can say, okay, if you have it, stay inside, and then if you don't, you can go outside. But then a lot of people were being like, oh, like, I don't want to be tagged and like all that stuff. But it's like realistically, like in order to stop it, that's literally the only way is to find out who has it, make sure it goes away to avoid a second peak, especially in New York City.
And I think that's the other thing is the second peak is kind of scary. We don't know when this is going to end, and I think that's what's scaring people a lot.
Mm-hmm.
And for people, especially with mental health issues or people in situations that they're stuck inside, it's hard. It's really hard to hear about that too because we have so many angles we have to look at.
Yeah.
But right now, we got to do what we have to do, and this is what it is. We can't do anything about it. It's here. We're dealing with it. We're doing what we can.
Yeah.
But hopefully, we can get on it and we can get rid of it soon. But for now, we have to follow what's being said and do our part.
Mm-hmm.
Our part is social distancing and staying home right now. So hopefully this blows over. We have a year left of school.
I know. It's like crazy to think about if like next semester we don't have clinicals again.
I know.
Because it's like you were saying, like clinicals alone, it's so different from working in the field. I can't even imagine like not just having virtual ones, essentially not having clinical at all.
And here's the thing too, for people like us graduating next year.
Mm-hmm.
The seniors now, they got it their last semester, more or less. They're done with clinicals. It's usually just capstone now.
Mm-hmm.
But for us,
we haven't even hit the hard classes yet.
And how are hospitals going to handle us not doing these clinicals?
Yeah, I know.
How are they going to, what are they going to do for us? And how are they going to handle that? How, are they going to penalize us for that? Like, what's going to happen?
Mm-hmm. Even the new grads now, like a lot of facilities just don't have the time and equipment to train the new nurses.
Exactly. That's another big thing is people coming into this. The training process, unfortunately, has to kind of take a step back from what it usually is because we can't meet in big groups. We can't be out and doing trainings with 35 plus people and everybody that they hired. Now it has to kind of just be specifically your area, which is scary, but that's what it is right now. So hopefully we can adjust to it after the fact. That's going to be a big thing too. What are we going to do after the fact and how are we going to adjust to it?
Yeah.
So, I mean, I would really suggest anybody that can try and get the job at a hospital to help out, even if it's just as a student. Some places like New York Presbyterian, they're hiring students just to go around and do blood sugars.
Yeah.
They're hiring
because they need the help at this point.
It's extra help, it's extra hands. And you know what? As scary as it is, if you're comfortable doing it, this is great experience. Great experience. And it looks great down the line when you're going to go for interviews after you pass your NCLEX. It's going to look great that you were a part of this. You kind of took the initiative to start working during this time. It's going to look great on resumes. It's going to look great as a hiring factor for you in the end.
And realistically, like while there are younger people, like unfortunately dying, like the risk is much higher for the retired nurses and doctors that are having to come back.
Definitely. I mean, like I said too, there are young people getting it. Usually it is underlying risk factors. Sometimes they're saying it's not, but as long as you're protecting yourself and taking the correct measures, you're going to end up being okay, Yeah. Like I said, if you want to do it, if you feel comfortable doing it, it's a great experience to do. And it's a great learning opportunity. Like I feel this experience I would never ever get in clinicals, ever. This is not something you're going to be able to learn in school. This is something you're going to have to learn hands-on. So.
Yep, very true. Yeah.
So thank you for
having me. Thank you. Oh my God, you were so good.
Thank you.
So that was the video. We literally talked for so long afterwards because like I haven't seen her. Well, actually I did see her like at the mall like a couple weeks ago. No, not weeks ago because quarantine. Like last year I think. I don't even know. But I saw her at the mall. And yeah, she commented that she wants to make a video and I'm super, super, super appreciative of her. And especially everyone that's working right now during the front lines, like CNAs, nurses, doctors, respiratory therapists, maintenance staff, speech pathologist, literally every single person in healthcare. There's so many different professions. I'm super, super grateful for everything that's happening. But just please, please, please remember, if you're going to go outside, have extremely good hand hygiene. You do not need gloves if you have good hand hygiene. Do not cross-contaminate. Like, if you're going to wear gloves, don't touch your face. That's basically defeating the point of wearing gloves, and you basically just wasted some PPE for a hospital care worker. So please, please, please stay safe. Physical distancing. It's not social distancing anymore. but physical distance yourself. Yeah. Again, thank you, Nicolette. Thanks for being awesome. Thanks for watching, everyone.